Do want to welcome in our next guest here to First at 4. We have Jamie here from Interim HealthCare. Going to talk a little bit about how business has changed for you through the pandemic and here as we're kind of navigating on the other end of it.
Yeah. First, tell us a little bit about Interim HealthCare.
So Interim HealthCare is locally owned and operated. We're part of a franchise system, which is fantastic because we have the ability to reach out to our national and corporate headquarters for support when we need it, but we're so local to the community. So we're able to cover, our local branch covers Erie, Crawford, and Northern Mercer counties, as well as our other branches in Pittsburgh and moving a little bit south, and then sister companies into Ohio. So we really can cover the whole portion of Northwest Pennsylvania.
And I really don't think there's a business out there that says, you know, that would say their business hasn't changed in some way because of the pandemic. You guys, you said yours have grown. People are choosing to have that healthcare in the comfort of their own homes.
Absolutely. In the midst of the pandemic, there was so much problem trying to get therapy in a skilled facility. The numbers were just, it was tough. And not being able to visit your loved one certainly made it challenging. So we've seen an increase in folks that maybe have an elective surgery and need to have some physical therapy afterwards. And they're able to come home and get that service right in the comfort of their own living room.
And that just makes sense because in that specific case, if you've had surgery, it's hard, you're not mobile. It's hard for you to get back in the car and get to a facility to have it come right to you. I think that it would make the patient much more open to doing that aftercare.
Absolutely. And part of the Medicare guidelines for having those services brought into your home is that you have to meet a homebound criteria, meaning that it takes a very taxing effort to be able to leave your home. So for those short-term acute things that happen like a surgery or a setback medically, it really does make perfect sense.
Or perhaps transportation. Perhaps it's an older person that cannot get themselves to and from, physical therapy.
Yeah.
Tell our viewers a little bit about how they can get in contact with you and Interim HealthCare if they're thinking, wow, this might be something, if they're planning ahead to an elective surgery or, if something comes up in the future.
Yeah, absolutely. So the best way to reach us, we have a dedicated secure phone line. It's 814-413-3930, and someone answers that number 24 hours a day, 7 days a week.
All right. Jamie Fowler, thank you so much for joining us and telling us more about Interim HealthCare.
Thank you.
We do appreciate it.